And I like to define what we mean with some of our words. So hypoxia means a lack of oxygenation. Ischemia means a lack of blood flow. So with a lack of blood flow, you're not only going to get lack of oxygen, but you also get lack of glucose. And then you have the word asphyxia, which means an impairment in exchange of respiratory gases. So in you and I, that would be drowning, having severe pneumonia. But in a fetus or a baby in the process of labor and delivery, that would be their placenta, not doing its job of exchanging respiratory gases for the baby until they take their first breath and their lungs kick in and do that function. So when we talk about hypoxic ischemic encephalopathy, we're talking about a newborn who may have had hypoxic and/or ischemic injury, but also and/or asphyxia, an impairment of exchange of respiratory gases. So it can be any one of these or any combination, and it is often difficult for us to know what the exact mechanism of injury may have been on a baby that's being abruptly delivered by emergency C-section because of non-reassuring fetal heart rates or a sentinel event. And what we mean by a sentinel event is sort of like being hit by a car. So what would that mean for a baby that's in the process of labor and delivery? That would be a uterine rupture, the placenta detaching and abrupting before the baby is born. It could be cord issues such as a very tight knot in the umbilical cord itself. It could be cord prolapse, where it is protruding from the uterus and therefore is being compressed with each contraction. It can be a cord tear. It can be the maternal trauma, cardiac or respiratory arrest, and if severe enough, also maternal demise. All of these would obviously disrupt the baby's ability to get oxygen and/or glucose, and therefore cause injury. And since 75% of the blood flow before you're born is going to your head and neck, and obviously the organ of most interest in the head and neck is the brain, not your ears or your shoulder. The organ that we're all concerned about in a baby presenting with clinical signs or history of hypoxic ischemic encephalopathy is actually brain injury.